Hello everyone, welcome to today's video in which I'll be covering about coronavirus disease FAQs, that is frequently asked questions. There are some frequently asked questions which in today's video will be talked about. Number 1, how does the COVID-19 virus spread? Number 2, what are the symptoms of coronavirus? Number 3, how can I avoid the risk of infection? Number 4, should I wear a mask? And number 5, does COVID-19 affect children? All of these are major questions which we all want to be clarified about. So let's go ahead. Question number 1. How does the COVID-19 virus spread? The virus is transmitted through direct contact with respiratory droplets of an infected person, generated through coughing and sneezing, and touching surfaces contaminated with the virus. The COVID-19 virus may survive on surfaces for several hours, but simple disinfectants can kill it. Current evidence suggests that the virus spreads mainly between people who are in close contact with each other, typically within 1 meter, which is a short range. A person can be infected when aerosols or droplets containing the virus are inhaled or come directly into contact with the eyes, nose, or mouth. Question number 2. What are the symptoms of coronavirus? Symptoms can include fever, cough and shortness of breath. In more severe cases, infection can cause pneumonia or breathing difficulties. More rarely, this disease can be fatal. These symptoms are similar to the flu, which is influenza, or the common cold, which are a lot more than COVID-19. This is why testing is required to confirm if someone has COVID-19. It's important to remember that the key prevention measures are the same: frequent hand washing and respiratory hygiene, covering your cough or sneeze with a flexed elbow or tissue. Then throw away the tissue into a closed bin. Question number 3. How can I avoid the risk of infection? Here are 4 precautions for you and your family to take to avoid the infection. Number 1. Wash your hands frequently using soap and water or an alcohol-based hand rub. Number 2. Cover your mouth and nose with flexed elbow or tissue when coughing or sneezing. Dispose used tissue immediately. Number 3. Avoid close contact with anyone who has cold or flu-like symptoms. And number 4. Seek medical care early if you or your child has a fever, cough, or difficulty breathing. Number 4. Question. Should I wear a mask? The use of a mask is advised to protect others even if you have no symptoms. After masks are worn, they must be used and disposed of properly to ensure their effectiveness and to avoid any increased risk of transmitting the virus. The use of a mask alone is not enough to stop infections and must be combined with a frequent hand washing with soap and maintaining physical distance. Question 5. Does COVID-19 affect children? COVID-19 is a new virus, and we are still learning about how it affects children. We know people of any age can be infected and transmit the virus. However, older people or those with pre-existing medical conditions seem more likely to develop severe illness. Cold, mild cough, fever, and body pain are the common symptoms of infection. We have also noted that the other symptoms such as pain in abdomen, loose motions, and vomiting are also present in children. Clinical features or symptoms affecting children and adolescents possibly associated with COVID-19 can include, but are not limited to, fever, headache, body pain, tiredness, cough, breathlessness, poor feeding, loss of taste or smell in a child more than 8-year-old, rashes, red or pink eyes, swollen lips, tongue, hands, feet, and gastrointestinal problems. These are just a few ones, but there are more. So everyone, stay home, stay safe, and protect yourself and your family from this COVID-19 disease. This is the end of the video. Hope you enjoyed it. Please subscribe, like, and share. Bye bye.